my name is Jacqueline Richmond, and this is my speech on the dangers of overdosing on drugs. Drug overdoses occur when a person takes more than the medically recommended amount of drug. Drug overdoses can be accidental or on purpose. Accidental overdoses occur in either younger children or adults with mental health conditions that they can get to medication that's in their reach. Purposeful overdoses are usually done to harm oneself or to get high. However, some people may be more sensitive to certain medications, so a dose that is still within the range of legal medical use may be too much for their bodies to handle. Drug overdoses can involve people at any age, but it is most common in very young children and teenagers up to those in their mid-30s. Children younger than the age of 5 tend to put everything they find in their mouth. So drug overdoses in this age group are generally caused by medications being left in their reach, and they get to them and take them. Adolescents and adults are more likely to overdose on drugs to harm themselves. People who purposely overdose on drugs frequently suffer from underlying mental health conditions. This is what causes them to do this. In an overdose, side effects of drugs become more pronounced and other effects take place, which would not occur with the normal use of this drug. Large overdoses of some medications may not do very much to you at all. However, smaller doses of certain medications cause severe effects, probably even death. A single dose of some medications can be lethal to a young child, while some overdoses may worsen health problems that you already have. An example is asthma, which I have. If I were to take a certain medication, it could cause me to have an asthma attack, which would send me into an overdose. Some symptoms of an overdose may be sleepiness, confusion, breathing problems, vomiting, and sometimes you may even go to a coma. The person's skin can be cool and sweaty, or it can also be hot and dry, depending on the drug they have taken. Specific drugs can damage specific organs, also depending on the medication that they've taken. Your doctor or your local poison center or your emergency department of the hospital may be able to help determine the seriousness of the suspected drug overdose. Some doctors' offices are equipped to handle overdoses, while others are not equipped at all. A history and a physical exam to look for evidence of poisoning will be done. The doctor will order lab tests based on the organ system that can be harmed by the specific drug overdose. Treatment will be dictated by the specific drug taken in the overdose. The stomach may also be pumped to get the drug out. For certain overdoses, other medicine may need to be given to serve as an antidote or to reverse the effects of what has been done. The doctor will decide if treatment needs to be done or if additional medicines need to be used. After an intentional drug overdose has been managed and the person is out of danger, psychiatric care needs to be provided. The abuser of illicit drugs should also be considered for a mental health evaluation. After this, you may be sent to a psychiatric ward or something like that so that you could get help for your problem if it was intentional. For children, the experience of being treated for an overdose may be frightening, so they need help in coping with the trauma, as well as being taught that they should not take medications that are laying around. And the parents should also be more careful when putting them up. Well, thank you for watching my speech. I hope that it helped you, and I hope you learned a lot. And I hope this speech did very well. Thank you for watching.